Hello, everyone. Thank you for joining Consumers Doctor's channel. This is where almost everyone asks me this question. How are you going to give the power to the consumer? And how are the consumers are able to pay for what you're saying? Folks, this is doable. Yes, it can be done. A lot of folks say, oh, people can't afford it. People cannot pay for it. People cannot pay for the health care. It's so expensive. They're right. They are expensive. But the way I'm proposing, first, the healthcare cost keeps rising and rising. There's no end in sight, folks. There's no end in sight. How can we lower the costs? You think single payer Medicare will lower the costs? I, anytime the government gets involved, it gets messy. Too many regulations. Look at the mandates. Look at the mandates. People lose control. You lose your independence. And what I'm suggesting is the right way to do it, folks. Is the right way to do it. Okay, tell me how you're going to do it. All right. First of all, when they ask me how are you going to pay, there are three avenues, folks. There are three avenues. One, there's no doubt we have to have insurance. We have to have insurance premium. We should be able to pay the insurance premiums, but they should be affordable. And consumers have to demand the affordability of the insurance. Right now, the insurers are taking us on a ride. They're least interested in lowering the cost. Insurance companies are least interested. First of all, they don't want even fragmentation. Like, when you're talking about healthcare, you need to have a segmentation into four categories. Yes, four categories. Why four categories? Okay. Well category. Majority of the Americans are healthy. Majority. 65% of the Americans are healthy. They don't never see a doctor. They never go to any testing, and they may do ongoing screening, but they never have surgery. So most of these people, when they're healthy, their premium should not be more than $50 to $100. The health insurance premiums I'm talking about. The second category, when you have acute illness category, where you're predisposed because you're a smoker, you're an alcoholic, you are into drugs. There are lots of hypertension, diabetes. These are all predisposing factors. These are in the second category where their premiums have to be 10% higher because they are predisposed to certain conditions and they're exposed to more risk. So that's why your premiums have to be a little higher, maybe another 50 to 100 bucks. What is the third category? This is where most of our expense is, chronic illness category. We can address the chronic illness. We need to focus on this segmentation. I'm talking about 15 to 18% folks. Maybe it's 12 to 15 now. The sickest, most of the people with chronic illness are a small percentage, like 15%. And their premiums have to be based accordingly, depending on how much the usage. But the consumer has to if the consumer takes care of it, most of the problem, the insurance premium can be lowered. It all depends on the consumer. If they are personally responsible, if they can take care of themselves, if they can uh, do most of the things right, you need to incentivize them. This is where it is. You need to incentivize these folks. Every category needs incentivization. This is where consumers play a big role because the personal responsibility comes into the picture. When you have health savings, which are like your tax deductible health savings put aside, and they have funds available, they have a debit card, and they can use the funds for the deductible portion of the fund. I'm not talking about the insurance premium, but I'm talking about the deductible portion. Whatever the deductible health insurance does not cover, they should be your health savings account should be able to pay for it. So when you have a health savings account, it empowers the consumer, folks. This is the beauty. It empowers the consumer. And the amount you're contributing is not actually, it's good for the employer and an employee in this having an HSA. Originally, when it started in 2002, it was we had only 200 to 300 billion. Right now, your health savings account have mushroomed to $1 trillion. Most of the larger employer groups are providing health savings accounts. Where we are missing is the self-employed, smaller employer groups. They're not able to, they need to be educated. So this category, when you're talking about a small businesses, individual, self-employed, so-called entrepreneurs, they need to be educated how to get, they have to be incentivized to make sure that they get the health insurance what they need at an affordable price, folks, affordable price. Obviously, it has to be affordable to the level when you segment it, when you segment the health point of view, when you segment it, the premiums have to be low. Right now, the insurance companies are fighting because what is happening right now, your health insurance for everyone is based on a broad category of entire 300 million Americans. If I'm young and healthy, my premium, right now, the way I see it, even if you're 30-year-old, you have to pay $300-400 in health insurance, which is not right. It has to be brought down. When you segment, when you're healthy, your premium should not be more than $50 to $100. Health insurance premium. Obviously, the deductible that qualifies you to put money aside into the health savings account. Health savings account is your personal account, folks. You control it. Consumer controls it. You have to have 100% control on your health. It's like an IRA, your personal IRA. It has better benefits than an IRA, which not many people are aware of. Every time I ask them, oh, everybody has an IRA, but when you talk about health, there are not many folks understand how the health savings works. It is better than an IRA. Why do you say that? Yes. First of all, the contribution. I'm talking about $10 a day for an individual, $20 a day for the family, which comes to $300 a month for an individual, $600 a month for the family, which comes to $3,600 a year for an individual, $7,200 for the family. Every year, you can put aside, it's tax free. Put aside, you don't pay taxes. If you're getting an income of 40, 50,000, you can literally put money aside tax free into your, in addition to the IRA, you can put it to the health savings accounts. Once you do that, year after year, year after year. Those funds will mushroom in 10 years. It will be 36,000 will become 50,000 because it is tied to the market, where it is tied to an index funds. At the same time, for a family, 72,000 will become 100,000. Can you imagine having a HSA funds 100,000 in a family having an account, which gives them the tools with the debit card? So you don't need to have any billing, folks. I'm telling you, there's no reason. The billing system needs to be eradicated because of these bills, a lot of people are getting hurt. A lot of people are getting surprise medical bills. When you get hospitalized, this is the way it should be. When you get hospitalized or you go to the ER, they have to tell you how much this is going to cost you. If you get hospitalized, then before you get discharged after 2 3 days, you need to sign the the entire. It's like a when you check into the hotel before you get sign out, they send you a bill. It has to be the same process. So is that a difficult? There should not be any billing because the billing. This is what happens. The same procedure which costs $1,000 and the back end they bill for $10,000 without consumers' involvement. This is where the problems are. Consumers have to be aware. When a consumer comes in and gets discharged from the hospital, he needs to know what the bill was. He has to, how much are they going to collect it from my insurance company? Whatever the deductible portion, I will pay for it. But the rest of it has to be paid by the insurance. Once you approve that payment, the insurance company is obligated to pay that. And basing on that, your premiums are based on your consumers being aware how much the bill was, how much the insurance company paid for the service. That is the reason why consumers, before they enter into the hospital, they need to know what the cost is because they have a health savings which they can pay right up front whenever if it is a smaller amounts because of the deductible portion. But ultimately, and the back end, whatever the deductible is covered after that, the insurance kicks in. But even if though you have insurance, you need to know before you get in what the cost is. So that way, when you get signed off, they need to be aware how much the bill will be. So that way, you are keeping your premiums lower and more affordable. By signing off a document, your premiums will be. So that way, you're aware that premiums will not go up next year. This is the beauty of having a consumers being in the front line, folks. That's what I've been saying. And there are folks out there, they're impaired, they cannot take, they're economically impaired, physically impaired. Those folks need help. You know what the percentage of those folks? Believe me, those folks are less than 2 to 3% of the entire population. Entire population. Only 2 to 3% of the folks cannot take care of themselves. That's where we need to give them a certificate of guaranteed coverage by so-called public under the umbrella of public-private partnership. The Health Review Authority under the public-private partnerships will be able to give a certificate of guaranteed coverage. How do they get funded? Well, it is partially funded by the private companies and partially funded by the government. And there is no government involvement in the proposal which I'm saying. It is entirely the consumer driven. Look at where Amazon is. There is no Amazon without a consumer. Consumer demands lower healthcare costs. Consumers should be able to shop for the services what they need, and they should be incentivized if they take care of themselves, their blood pressure, their blood sugar, their weight, they watch their diet. They should be incentivized, folks. I believe in consumer driven healthcare. I don't know about you guys, but I really do believe in a consumer empowerment. We will be number one. We don't need to spend $3.8 trillion. I'm I'm not kidding. There's no reason. Our healthcare costs will be one third, not even half, one third of 3.8 trillion. And we're going to be number one. How about that in providing the healthcare? Because consumers will bring the costs of the healthcare. No one else can. No one else can. Neither the government nor the insurers and pharmaceutical, nobody. Consumers demand, even the pharmaceuticals, it has to be driven by the consumers because consumers demand more transparency of these pharmaceuticals and the cost of the drug. When they're advertising, when they're advertising for a drug, it has to be transparent, the prices, how much it is, because consumers are the one who's going to pay for it. That's how you bring the prices down, folks. Well, I hope I conveyed my message, but I'll keep on talking about consumer driven, personalized healthcare. Thanks for listening. I do really appreciate if you do like this channel, subscribe, share, and make some comments. And Consumers Doctor is a volunteer for a Dollar Care Foundation, which is a nonprofit. We would like to see contributions to a nonprofit so that way we can set up, if the Dollar Care Foundation is successful in its ventures, we would like to set up the facilities which is more affordable for consumers. Yes, folks. Not only they will be able to, consumers can receive the best care in those facilities. Thank you for listening. We'll see you next time. God bless.